Should all children be given free dental checkups and free dental care? My guest and I will discuss this issue on Talking with Henrietta, coming up next. Hi, I'm Henrietta. Welcome to the show. Did you know that dental care in the U.S. is in a sorry state? The latest data released by the U.S. Center for Disease Control and Prevention, the CDC, show that nearly 1/4 of Americans 65 and older have lost their teeth. 1/3 have untreated tooth decay. More than 181 million Americans won't even visit a dentist, and about half of those over 30 suffer from gum disease. Children from low-income families are hard hit, since they are twice as likely as those from upper-income families to have tooth decay. Is it any surprise that Mexican-American children are disproportionately affected? So what is being done to improve the condition of the public's teeth and their oral health care? On this show, I have 4 guests who will discuss what one local Bay Area community is doing to provide needed dental care in the to the community's residents. My first guest is Dr. Yogita Thakur, who is a director of dental surgery who practices at the Ravenswood Family Health Center in East Palo Alto. She has a Master's of Science in Dental Public Health from the University of Iowa and a certificate in Pediatric Dentistry and Global Health from UCSF. She has been at Ravenswood for almost 9 years and is the Chief Dental Officer. She is currently working on initiatives to improve the oral health of the East Palo Alto community. Joana PaOaga is a dental assistant who joined the Ravenswood Family Health Center as a volunteer in the clinic. She was soon hired to work as a dental assistant. She currently works with the dentist in the Ravenswood Clinic and also in the operating room at the Lucille Packard Children's Hospital. Corali Tejada is a dentist from Peru. She has been with Ravenswood for 7 years. She started at the clinic as a dental assistant and became the back office dental manager 2 years ago. She is currently taking classes at the University of Pacific School of Dentistry to get her extended function certificate, which will allow her to assist dentists in placing fillings and enable the clinic to see more patients more efficiently. My last guest is Diana Deras Magana, who has been a registered dental assistant at the Ravenswood Family Health Center's dental clinic for 5 years. She became interested in becoming a dental assistant in high school, and she says that the best part of her job is to help people smile again. Well, it seems to me that's something that all of you all are doing, right? Helping people smile again. So, you heard me with the statistics at the top of the show. Does that correspond, those statistics? Are they as dire as they seem? Is dentistry, would you agree, in a sorry state?
Sometimes it can be. I think in our community especially, it's like more low-income families who don't have those opportunities anywhere else.
To go to the dentist?
Yes. So what they do is sometimes it happens where, they'll wait until someone's having pain to realize, oh, they need to go to the dentist because they don't know, oh, we have this. Our insurance can cover this. That's their main issue, is they don't know if their insurance will cover, so they don't know if they can get that help.
And so they wait until somebody's in pain?
Usually that's what ends up happening sometimes.
Is that rather late when someone's in pain?
It is. It is because once a person is in pain, then or symptomatic, either with a swelling or an infection in and around the teeth, then you're only looking at how you can get them out of pain, which may either need a root canal or an extraction, and those can be expensive and. A lot of our patients, again, for financial reasons, may or may not want to get that treatment and opt for an extraction. And over time, once you start to lose one or two teeth, it's a snowball effect. It
So
affects
do you
the
find
other
that with
teeth.
children? Do you have children, young children, who come in needing root canals and extractions?
We absolutely do. Also, for the children, it's a little bit different. As another thing compounds the issue, and that is that fact or the myth that we believe in, saying, "Oh, these are baby teeth; they will fall out." So we're going to get the big boy or big girl teeth, and we will take care of them. And it's okay if these teeth get cavities.
Ah.
So that mindset with not knowing what their insurance does and does not cover, and sometimes not even being able to access a dentist.
So let's talk about that. The myths. Those baby teeth will fall out, right? So that's
would.
true. Now, what's the problem thinking they'll fall out, so if they have cavities, it's okay? What's the problem with that?
The problem with that is that the cavities will cause the same amount of pain if the teeth get infected for the lifespan of that particular tooth. So,
But would the baby teeth become infected?
the baby teeth will become infected.
They will too. The cavity
They
will go
could.
to the baby teeth.
Yes.
Oh. What's the most serious case that you all have seen?
There's been many. It's hard to tell which one is more serious than the other because we see pretty much any type of thing that walks through the door.
Yeah, actually we see patients like they came with the baby tooth is 20, so they came like almost every single one with a lot of cavities.
All of the teeth?
All of the teeth.
How can people wait that long?
Like she said before, it's like sometimes they think they're baby teeth. We don't need to do anything if they're gonna fall out. But what they don't understand is that those teeth need to be like a placeholder for when their permanent teeth do come in. And if they lose them, what's gonna happen? Where are those other teeth gonna go?
So when a child comes in with the type of cavities that you just described, what's done with them?
So we explain first to the parents what's going on, and we come up with the treatment plan. It could be a wide range of things. It could be pulling teeth, doing root canals, putting crowns on, or fillings. And we tell them how we are going to go about it, but we also tell them how and why the kid got the cavity and trying to get to the root cause of the problem.
So is that usually the way they're eating, or lack of dental care, lack of brushing or flossing, or? So what primarily do you see?
It's a combination. It's a combination of what they eat, how often they eat, how's the brushing, and access to dental care.
So Joanna, what do you do for the most part when patients come in?
I assist them. I try to talk more about oral health. Sometimes they have questions they're not sure, so I try to give them advice only if they let me. But
What type of advice do you give them?
you know, brush your teeth, try to floss every night, have a habit of doing it every day.
Does that come as a surprise to them?
Sometimes they don't want to hear us. Sometimes,
Why?
yeah, sometimes they're just, I brush my teeth, but when the doctor goes in and check, it's not what they're saying, like they're brushing their teeth.
So what reasons do patients give for not brushing their teeth?
Sometimes they're scared, sometimes
Scared of what?
To see the dentist?
No, but I'm saying what reason would they have for not brushing their teeth?
They have,
They're tired.
yeah, tired most of
They
the
just
time.
don't want
yeah.
to do it. Like when I talk to parents, most of the time they're like, oh, they fight me, they argue with
Yeah.
me, they don't want to do it. So they just end up going to sleep.
Day after day.
Yeah.
But do they realize, does the parent realize what happens if they don't brush their teeth?
No, they don't
No,
realize
they
it.
don't know.
Tell me about their teeth.
And so I think, interestingly, that you point towards, how are the parents' teeth? A lot of these beliefs kind of stem from their personal experiences, how things turned out for them. And it's okay for them to get a tooth pulled for their child because it was okay for them to have had a tooth pulled in the last 5 years or 4 years or however long ago that whole process started for them. We take for granted that as a dentist and being in the dental field, that everybody has a toothbrush. That's not always the case. Sometimes our patients say, well, my brother took my toothbrush, so I didn't have one. That's why I haven't been brushing. Or
The brother took the toothbrush to use himself?
himself.
Oh.
Or
Well, at least somebody's brushing.
That's true.
or that somebody, they moved and they didn't have, so the things got mixed up and they don't have a toothbrush now. So those are also very real challenges that some of our patients experience.
So you have this primarily from parents and children in low-income communities. Are those the only ones you treat? Because I'm thinking would some of the stories be similar for those from other communities?
Well, we predominantly treat, patients from low-income communities at Ravenswood.
So when you go to Lucille Packard, do you deal with any other families from other income groups?
Not
No.
as much. They're our own patients.
Because the statistics talked about nearly 1/4 of Americans and 1/3 having untreated tooth decay, and that's not confined just to low-income communities, do you think?
It's not exclusively confined to the low-income community, but the low-income community bears the biggest burden of disease. So, you know how they typically say 20% of the population bears 80% of the disease burden. And that is true.
Sure. Now, you moved from Peru. You were a dentist in Peru?
Yes, I was dentist in Peru.
Was dental care any better in Peru?
No, actually, when I just started working in this community in Ravenswood Family Hall, actually I was feel very fortunate that where I work because feel like I'm in my country.
Oh,
Yeah,
the conditions were very similar.
Yes, the condition is very similar, and the other thing is a very high percent Latin patients that we have, so I can explain and educate and prevent to tell to the parents about what important is dental care. So for me, it's very easy how communicate to them in Spanish because they speak Spanish, and so they get that communication to me, and I say, okay, what you think is important? You know, the food is very important. How many times they need to brush and floss? So after we see how get improve that communication, and at the same time they know what important is to brush and floss.
So just the fact that Corali said the conditions that she deals with some of the patients here reminds her of the way some of the patients were in Peru, it makes me think, is this something that's cultural? Since East Palo Alto has a large immigrant community, do you think this might be
Yes.
cultural, or this might be just a general lack of knowledge?
I think
in
that what I think is that high percent is culture, because many people doesn't know how important is dental treatment. So they don't know how important it is because dental treatment affects your whole body too in different ways and reverse too.
So talk about that, how dental health affects your whole body.
For example, if we have an infection, so that means it could be affecting to your whole body.
The infection could
The
spread.
infection can spread and everywhere in your body. Actually, if you have any abscess in your tooth in the backside, they can go through your head, and you can die for that too.
Sure, and I understand too, inflammation, it sets up inflammation in the body that gives cause to all kinds of diseases like heart attacks. And so this can come just from having teeth that are rotting with cavities or abscesses. And
Because it is an infection that is caused by a bacteria. Caries is an infection, and it's the same bacteria that is implicated in other, infections in our body. So it can, compromise a weak heart. It can cause, like Corali mentioned, how the infection can travel to your brain, and you can, that could be fatal.
do you know, that reminds me, I had a friend of the family some years ago who woke up. This was a man in his 30s, and he woke up and he couldn't move. And he had to be rushed to the hospital. And it was found that he had a problem with his tooth that had gone untreated, that all of a sudden caused paralysis. Is that something you would believe? That's actually something that had happened.
Yes, absolutely. And I will say, but last week, we were following up on one of our patients who had spent 2 weeks in the hospital from a dental infection. The infection was so bad that she had to be hospitalized for 2 full weeks.
And she had done nothing about it at all?
Nothing until...
Maybe taken aspirins or for the pain, or... But how can people eat? I mean, if you're going through that much pain and having a problem of that magnitude, how do you continue to go on with life as normal? Or do you spend time in bed?
So we think that life goes on. We know for children in particular that if they have cavities, that's the #1 reason for absenteeism from school, reported reason. These kids have difficulty learning, they have difficulty eating, so their diets change. It modifies from a regular diet to soft foods that are easily, or liquids.
How long can people continue with conditions like that? How long can a child be kept out of school because they're having a toothache? And how long do they continue on to the point of eating soft food without coming in for some type of treatment?
It varies for kids, I'd say, because sometimes the hard thing is that kids don't like to tell their parents when they're having pain for fear of going to the dentist. So the kids will just try and deal with it as long as possible until they're like crying at nighttime saying that it hurts. And it could be days, weeks, months.
So what does the child think? Getting into the head of a child, right? Does the child think this is eventually going to clear up by itself? Or
Sometimes they do.
Oh.
Yeah. They try, they'll eat from the opposite side if they can. They'll put it off as long as possible, because for kids it's like, oh no, my thought is I'm going to the dentist and they're going to take out my tooth, and that's it. So they prefer not to tell their parents.
So I'm going to ask you what can be done in the community or in any community to change the image that dentists have. Rather than being a friend, not an enemy.
So, the children who come to us very early on and don't have problems actually do very well. And we're able to prevent, we're partners with parents in finding ways to change diet, to modify brushing, to find ways how they can prevent cavities. And that seems to, help, and the kids have a good experience.
And do you find what you tell them allows them to develop habits good habits, or do you see some of the same parents or children back with some of the same problems because they didn't change their behavior?
Yeah, I would say both. Both, because there are some parents who have, with their first child, had to deal with a lot of dental issues, and when the second child comes along, they're like, tell me what to do so we don't have to go through this again. Whereas some, it was like, oh, the same thing happened with my older one, and I know this baby's going to need the same kind of care as well.
So people aren't quick to take preventative action.
Yeah, it's hard to change sometimes. Yeah.
Ah, so does that make you feel you're going uphill? Now, you, Joanna, give people advice in terms of what to do.
Just if they have any questions, if they're scared of the doctor, I try to explain to them what's going to happen instead of them having their past, like what happened to them in the past. So I just try to erase their past and try to focus on what we're going to do in the present.
Oh, so people,
so most of the
people have
time,
bad experiences with dentists, or
with the dentist
at home trying to put a string on a doorknob to pull their tooth.
Yeah, that's true. Yeah,
Really?
Yeah.
So talk about some myths, if you can think of myths. For example, the idea, we talked about how the baby teeth will fall out. So what are the myths? I know some people think for every child you lose a tooth, for every child. So talk about some myths that you're aware of that are just that, myths.
So, one is if you are pregnant, there's gum disease always happens during pregnancy, or your gums bleed during pregnancy. That's a myth. Like you said, these are baby teeth, they will fall out eventually. It's okay. That's a myth. And sometimes not even knowing what it might be. What we identify as cavities. The parents say, oh, those dark black spots, I had them too, and then they just they were fine. The teeth didn't hurt, but they were okay. I had them too growing up, and now I don't.
Is that because they don't have any teeth, or how is it that happens for them? That those dark spots they don't have anymore?
So it's also not. We're never sure whether they're alluding to to cavities as dark spots, or a dark spot from something else on their tooth, a stain. Yeah.
Oh, do you run into myths or ideas that people have that make no sense in our way of looking at things?
The only thing that I've heard is that, oh, I'm not in pain, I don't need to go to the dentist. That's the biggest one that I hear.
Do you hear certain things, Corali?
No, I think this is the more famous part. It's like, oh, I don't have to go because I don't have any pain. So they don't, that's what I'm saying, they don't educate it on how important is dental treatment, or how important is go to the dentist every 6 months. So the doctor can check and can prevent any cavities or big cavities or any toothache in the future.
So let's talk about the clinic itself. When did the dental clinic start in East Palo Alto?
In 2010.
And how many patients did you see, and were they just children? Were they adults?
We see from adults to kids.
Adults to kids. That was in 2010.
We see adults, kids, homeless patients.
Were there lots of patients coming in at that time?
Yes, so our first year we saw close to 8,000 patient visits.
Well, it seems that either a lot of people were in pain. How do you account for that many? Or they said, oh, we can have our teeth fixed, or...
Yeah, so this is a fact. It's just not a fun fact that before the Ravenswood Dental Clinic opened, the dentist to population ratio, which is considered like a measure of access by the federal government and and American Dental Association, what the ratio was 1 dentist to 82,300 patients.
Oh my goodness.
Which just
meant there would have been about 4 dentists for East Palo Alto, since it has a population of about 30,000.
Yeah. So our service area is East Palo Alto, East Menlo Park, North Fair Oaks.
Which is in Redwood City.
In Redwood City, yes. Combining those 3 areas, that was what so it talks about how great the need was. Even if the patients were in pain, there probably was nowhere they could get in other than the emergency room.
And that's where lots of people went? Emergency rooms in hospitals?
In hospitals.
They take care of your teeth? Or would they just give some type of pain medication and refer them to someplace else?
Yes.
So where would they go if they're given pain medication and referred someplace else? Would it be to a local dental clinic?
It would have to be, but in
There
the absence
wasn't
of
one.
there was yes.
So what
either
would
people
happen to people?
Or either they went to other counties or other areas where they could find a dentist, or when they felt better, they didn't need to go because the antibiotics helped for the short period of time.
Oh, so for that first year, 2010, you saw 8,000. So talk about, this is 9 years later. So what has happened in those 9 years?
Way more than 8,000.
A gradual increase?
Oh, yeah.
Oh, yeah.
So how many now?
16,400 visits last year.
Last year. And so there was a decision to open a new clinic.
Expand our existing
Yes,
clinic.
talk about that.
So, it was in keeping with the demand. What we saw was that the patients that are the number of patients coming in to seek care was over and above that we could keep pace with. And in order to be able to do more for our community, we needed more dentists and more room to accommodate those dentists and those patients.
So about 2 weeks ago, there was a grand opening for a new clinic. And we have some pictures, and we can show the ribbon cutting for the clinic, and you all can talk about it once we get the pictures up. So that was the grand opening. So talk about that. The clinic itself, how many more people, clients, will the new clinic accommodate?
We have 9 more chairs.
9 more chairs, and we can see what those chairs look like from the next photo. Are we looking at one of the dental rooms?
Yes,
What would you call it? Dental suites or dental?
Well, we like to call them quiet rooms.
Quiet rooms. Is that a room you all came up with? A term you all came up with?
Pretty much.
I mean, is that the very opposite of how the room would be used as a quiet room?
Sometimes it varies on how a child can actually cooperate.
Ah, okay.
Yeah.
And in looking at the next picture, we have a tour being given by the Ravenswood Family Health Center Executive Director Luisa Boada on opening day, and we see one of the quiet rooms. Do you tell that to the young people? Oh, we're going to take you to the quiet room.
Not really.
That's what we tell each other, like what room to take them in.
He didn't know yet.
So for this side, what we did is kind of incorporate like different themes to kind of be a little more inviting for the kids. Oh, we're going to the Super Mario room. Oh, we're going to this room. It's all different. Each room has its own special theme that I think it will draw more kids in and not be like, where am I going?
Yes. So we'll go to the next slide, next picture. And this was the opening ceremony in the new clinic. And some of the attendees who came. Anything you want to say about them?
It's all people who have helped out.
These were people who had helped out
Yeah.
in terms of volunteers or
Yeah, all our staff too.
donors and
Donors.
yes. And what day was that? Do you remember?
March 18th.
March 18th. Okay. And we'll see the next picture that we have. And this was U.S. Congresswoman Jackie Spear came, made a presentation, and is being given flowers. She has been an ongoing supporter.
She has been.
Yes. Anything more to say about that day, the event?
You know, well, the event was, as you were there, you saw it was very well attended. You know, our both from our funders and from our staff and people in the community that we work with. And of course, Congresswoman Jackie Spear, we were very fortunate to have received a federal grant that helped us open the clinic.
Okay, we can lose the picture now.
And with the federal grant, you know, it is Congresswoman and her efforts all along to keep dental health, you know, in
No, you, yes, in
the
everybody's
forefront.
minds. Or
yes.
you made some comments yourself. Do you remember what you said?
I talked about my experience at the clinic. I have been there almost 9 years now, and you know that how it was, how we started 9 years ago, forming small partnerships with other organizations, having and you know kind of talking about how we kept identifying needs of our patients and finding ways to tackle them. So, for example, we realized that our patients needed an expert help of an oral surgeon, and to be able to do some of the more complex extractions, the wisdom teeth, and things like that. And we were fortunate to be able to hire an oral surgeon on our staff over the years.
No, it was this just, and I shouldn't say just, but was this a pediatric clinic? Or was this a regular dental clinic open for everybody?
It was a dental clinic open to the community for everybody. Children, adults, pregnant women, our seniors
so this
and
was
elderly.
an expansion of the current clinic.
Yeah.
And so you were saying that you had, what, 9 new chairs, 9 new dental
Chairs.
friendly rooms?
Yeah, quiet.
Quiet rooms.
Yeah. Actually, that part, the new part, is going to be all pedo area. So the other side is going to be for adult patients.
So this new part is all for
fetal.
children.
Children.
Children, yeah.
Yes, okay. So you saw 16,000 patients last year. What's the projection for, what, 2019?
2019, yeah. Since this would be our ramp-up year to get fully staffed, and we hope to add an additional 3,500 lives or patients that we can serve in the clinic. So hopefully getting our numbers of patients up, patient visits up to 17 or 18,000.
Is this, are these all new, or would this be repeat, or just the number of patients seen per year?
No, we will add some new patients, of course, but we'll be able to bring back the patients we have in maintenance and preventive care as well. Yeah, so a combination.
Now, has the clinic officially opened?
Not yet.
So we had a grand opening that was a formal opening, but it's not really open for business yet.
It will be on Monday.
This coming Monday?
This coming Monday.
Now, you talked about additional staff. Do you have the additional staff? How many more?
Not all of what we project projected to higher, but we will slowly be adding. Yeah.
Now, you also talked about doing work at Lucille Packard. How is it that under what circumstances do you go to Lucille Packard? And is that just the Children's Hospital? Okay, under what circumstances?
So some children either have special healthcare needs for which they cannot tolerate dental treatment in the dental office in a traditional dental setting. Other times these are patients who are either very young and have a lot of dental caries, just like how Corali mentioned, 20 out of 20 teeth, 16 out of 20 teeth, and they are so young that they're unable to tolerate dental treatment.
So is this, how can you be that young and have all of those many teeth decay? Would that be that they're eating a diet of candy only? I mean, how does that happen?
Bottle feeding
milk,
a bottle at nighttime, or feeding
where the milk just stays on the teeth.
and more juice in the diet, more refined carbs. That's what our diet, has really evolved to, refined carbohydrates. And those are a potential risk factor for dental caries.
So the parent might see that and simply assume this is natural development, don't worry about those teeth, they'll fall out, and they end up bringing the child, when they're crying in pain?
Yes.
Yeah.
Or
Infection.
that, the kids go to school and at school somebody mentioned, or the teacher mentioned that, your child refuses to eat and it's hard, and we looked in their mouth and, we're seeing things.
So are these common cases, or are these are common? They're not exceptional.
They're
These
not
are
an
common.
exception.
We see a lot.
Do you feel things are improving?
After a while, they can, because they've already went through it once. And then, say Dr. Yogita has to take them to Lucille Packard to do all the treatment. They don't want to go through that again.
What about the parent?
It's more for the parent, too. Like, the parent doesn't want to see their child put to sleep I don't know how many times to do work.
And for how long?
So it seems to me, since the child is so small, you have to give it anesthesia and put it completely to sleep.
Yes.
To get the cooperation to do the work.
And then when they wake up, they're groggy. They have pain medication that the parents are given, have to give it to them every so often, antibiotics.
Depending on what the treatment they got, yeah.
Now, you've been here for 9 years in the clinic. Have you seen any repeats of those children?
Oh, the same child needing
Yes.
treatment? Yes, but I can count those on one hand. We work very hard with our patients and our parents, explaining and meeting them where they are on how to make the changes that are self-sustaining and will help them get good oral health.
Okay, so we talk about the changes that people need to make. What are some of the changes you think people need to make on a daily basis? What do people need to do? What do they need to be aware of?
I think it's just an overall, just being more healthy. Knowing, getting that dental education when you go to the clinic. Knowing how many times a day to brush your teeth. Knowing what foods are good for your
let's
teeth.
talk about it. How many times a day should people brush their teeth?
At least twice a day. 3 times if they can.
In the morning when they get up?
In the morning, midday, and at night when you're going to sleep.
So what do you say for students who are in school about brushing midday?
When they come home from school.
Okay, which would be
I
about
do
3
mention
o'clock?
that for kids, yeah. I'm
Okay.
if you have a chance, please brush your teeth when you come home from school. It does make a difference. And then you see in preschools nowadays that they have time for the kids to brush their teeth at school.
They do?
Yeah.
Yeah.
So what do they do? Oh, do they supply toothbrushes? And
Yes.
They
the
do.
schools
The
supply
schools do.
toothbrushes.
Yes.
And then do they have a recess where they take children, say, okay, now go brush your teeth?
Yeah,
They
it's supervised. The teachers supervise that time of brushing in classroom. Yes, it's preschools. More and more preschools are starting to adopt that, and it's great to see that.
Oh, that's very interesting.
Yeah, they keep the toothbrush and toothpaste at school for every child. It's labeled in a separate bin, and every child has their own little container.
Well, I think that's a great way to develop habits, very good habits in the very, very beginning. Now, I didn't mean to stop you.
It's okay.
Were you thinking? I'm sure it
No,
was
it's okay.
But you can continue if there.
So I make an effort to say flossing is also important every day. Sometimes kids are like, oh, I floss when I have something stuck in my teeth. Like, okay, it's something that you need to try and do, at least with your parent every night. Flossing every night. And then I go into topics like, what kinds of snacks are you eating? Their favorites, chips, candies, cookies, all that. And so I try and tell them, oh, these types of foods are sticky for your teeth. They're harder to brush off. So try more, like, give healthier alternatives like yogurts, cheese, apples, vegetables, even though kids don't like them, but you know, it's something that you have to make them aware of. And then less juice, more water. Drink lots and lots of water. That's always
More fresh fruit rather than juice.
Yeah.
And do you feel that they're taking your recommendations?
sometimes.
They're giving up the cookies and the candy and the chips, or eating not so much of them. We're trying to add some of the good food too.
Yeah, because partly is for the parents too. It's not just for the kids. Like, they're hearing this stuff too. So it's up to them to help make those changes at home.
So I was going to ask you about that, the influence that this type of education might have on the parents.
Sometimes they hear it.
Well, they are the ones who have to make the change, and it's hard. And we talk about that as well in our discussions around how, you know, if you have chips at home and you eat them, then the child would want them too. But if we didn't have chips at home, but we had, you know, something else instead, we had apples or we had celery and cucumber, that's what you will eat and that's what your child will eat too. It's a lifestyle change.
Yes, it's a lifestyle change. And what fascinates me, and I'll go back to you, Corali, coming from Peru, I would think in a country that's more of an agricultural country, people would be eating closer to the earth, foods that are more natural foods, so that they wouldn't have the type of foods that would be so injurious to their health. But that's not necessarily the case, is it?
No. More the time, I think that it's the economy too. That's part of that, because
The economy here or the economy
in
there?
Peru, in Peru, because the cheaper things is the food that we don't really need to eat, right? It's something like more fast food. That's the cheaper food that parents can afford it for that. So that's why if they want to buy any vegetables or a healthy, you know, fruits or something else like natural, it's more expensive than you get something like juice or fast food.
And people aren't growing their own foods. They aren't growing their own foods. They're more in the city where they're going to grocery stores, just like here.
Exactly.
So the habits are continuing.
Exactly.
So do you work directly with parents in terms of education too?
I did before I got the management, but when I have a little time to go to the floor, I try to get with them and try to educate them how important it is to get how they can supervise. For example, nighttime is a more important brushing time to do. So they can supervise the kid. They brush really good, or did they floss? So they spend more time to them to be sure they are really good brushing and flossing.
So it's one thing to talk to parents about their children, and I'm wondering, these parents themselves, do you see them? Do they come back for themselves? They do.
Yeah.
Oftentimes they start with the children
Yeah.
getting care, and as they see the children being treated, they ask and seek care for themselves.
Well, that must be very satisfying to see that what you're doing is showing results,
Oh, yeah.
It is.
even though it's such a dire picture.
Sometimes it seems like an uphill battle, but you know, that's like on an everyday basis. There are days where it feels uphill, but the big scheme of things, it feels very gratifying.
Yes, so you have to look at the overall picture on a
Yeah.
on a week basis. So what has been, I guess, your most disappointing experience and perhaps your most satisfying experience?
My satisfying is seeing the kids, you know, leaving happy with
Do
a
they?
smile. Yeah.
Oh,
Yeah.
under what circumstances do they?
Sometimes it's when it's their first time visit. I know they're very anxious, but when we start to talk to them, they're like, okay, I know what this is. I know this is a mouth mirror. I know what a tooth counter. So we kind of like try to have them involved so they don't really like scream or anything.
And we're
So,
talking about what ages?
2, 3, sometimes 3, 4, yeah. But mainly, yeah, 3 sometime.
Oh, well, 3
3 years old.
3-year-olds are, what, very impressionable and very...
Sometimes they're hyper, but you know, when you try to calm them, yeah, they'll listen. They like to like touch things and
Oh, yeah, see
Yeah.
what that's all about. And
Yeah.
so are the parents there with them at that?
they're there in the
And what
room.
did they say? Are they
just like-
hyper?
Yeah, sometimes the parents are very scared and they're like, oh, I can't believe they actually sat there. Yeah, they're like
Well, it's a
shocked.
good thing maybe
Yeah.
the children weren't looking at the parents.
I know. Sometimes the parents are like very nervous and we're like, are you okay? They're like, yeah. Yeah, so
Sometimes,
Yeah,
sometimes
sometimes the
parents are more
parents is-
nervous and the parents.
yeah.
Now, is that with a tooth cleaning or with problems?
Yeah,
or?
well, we do.
Both.
Both.
Both cleanings or even fillings. Sometimes,
Fillings,
like
yeah.
she explained, she'll go over before the dentist comes into the room. Joanna will explain to the child, show them everything, and the parent would be like, "I'm not so sure. I'm
Yeah.
not so sure," and she does a good job of kind of calming them and saying, "Just watch. You know, we'll see how the child does. We'll work with them," and the kid surprises all of us.
I guess the kids want to act like big kids, huh?
Yeah.
What are some of, now, we talked about your most satisfying experience.
Wow. I don't know what to say about.
The most disappointing or the
Well,
most...
I mean, the only disappointing thing is just when they have to repeat themselves when we talk about oral health and then they come back. I mean, we can fix a cavity just for that tooth, but if they're going to come back and we're going to fix more other teeth, that kind of like, for the parents not setting a goal to keep their teeth clean, but then we have to constantly keep doing each tooth a cavity all the time instead of preventing not getting a cavity. So that's just my disappointment, like not having the parents doing their job, but we can fix the cavity, but the parents like, yeah, it's okay.
Oh, it was
but
fixed once. We can
yeah,
just
we
come
can do it
back
again. Yeah. So that's the only, yeah.
So when a tooth falls out with children, or you have to take out several teeth, do you do any replacement of teeth?
For children, usually not, but for adults, yes.
You do that for adults. And what does that involve?
We do crowns, bridges, dentures.
Partials.
Those, yeah.
So you do everything, basically. And what about the payment? Is it all free in the clinic?
So we're not a free clinic.
Okay.
We accept Medi-Cal. So if the patients have Medi-Cal and it's a covered service through Medi-Cal, then we bill Medi-Cal and there's no charge to the patient. There are certain programs that provide free care for a group of a population. For example, we have a grant for the homeless, healthcare for homeless. And so if the patient is homeless, then they have free dental care.
Do you see a lot of homeless?
We do.
Do they come in?
Yeah.
And I guess their situations are absolutely dire, are they?
They vary, and with the economy, changing in the in the last 9 years that I've been here at Ravenswood, the definition of homeless has changed. We know with prices going up and people not being able to afford to rent, that even though they have a job, that
They might be sleeping in their cars.
or with a friend or with a neighbor or with another family member.
They're not necessarily people out on the streets.
Right.
Now, do you see people out on the streets?
We do. Yes, we do.
I would think their situation would be dire. Or would you say not
Yes.
necessarily?
It comes in all shades again, but yes, most of the time it is.
So what's your greatest need now?
It's hard to say.
The greatest need, I think, to be fully staffed, to be able to serve our patients is our biggest need right now.
And what would that involve, being fully staffed?
Hiring dentists, dental assistants,
How many?
dental assistants, up to 5 more.
And you're a dental assistant.
Yes.
And you're a dental assistant. So you're being kept very, very busy.
Yes.
Now, I introduce one of you in terms of being a backroom dental assistant.
That's me.
Yes, and what's a
Sterilization tech.
backroom dental assistant?
So I started off being a sterilization tech. So I'm the one that's in charge of taking care of the instruments. From
All of the instruments?
all the instruments in the office. I learned from there for volunteer for I think 6 months, and then I got hired. So then they put me on the floor, started to learn dental assistant duties. Yeah.
And so how do you sterilize the instruments? Every instrument that goes into somebody's mouth is sterilized, everything.
Yeah.
Do you put them in a machine
Yeah.
or
We have to soak them. We have
in
to.
alcohol or?
There's a certain solution we have to use. Yeah. So and then we pack them. Then we put them in the oven, and then we stamp them. Good to go.
Good to go. Now, if you were to talk to the viewers about what you consider important, what would you want people to know? It could be about their health care, their teeth, the clinic. You could be talking to the parents, to the children.
Like my biggest thing is don't wait till you're in pain.
Don't wait until you're in pain.
Yeah.
I think our goal is to get involved more to educate to the parents so the parents can go and follow the kids how important it is to do dental treatment and dental checkups every 6 months.
And how do you plan to reach the parents who come in?
The parents, more the time they came with the kids. So I think it's a good and perfect time to talk to them how they doing for the kids.
Do you have programs that work with the schools?
Yes.
We have a virtual
I
dental
think we
home.
have one.
Yeah. You want to talk about it, Joana? The virtual dental home?
I know we have 2 assistants that goes out to preschool, all preschool in the Bay Area.
Well,
Yeah.
in our county.
In our county, and they do checkups for kids.
Oh, they do actual checkups.
Yeah.
Do they carry toothbrushes and
Yeah.
sample toothpaste? And
Yeah.
Yep.
The goodie
Yes.
bag. Yeah.
is that what it's called? The goodie bag? And do you invite them to come into the friendly rooms? Or?
Yes.
Usually they have it in classroom. Yeah. The 2. We have the hygienist, right, and the
Oh,
assistant.
that's good to know.
Yeah, they go out to every school and they do oral checkup, take pictures, brush, see if they have any new cavities.
Now, is there a virtual clinic?
Yes.
That's the
and
virtual
what's
dental
That's the
home.
virtual
Yeah.
clinic.
Yeah.
Yeah.
Virtual meaning to go out into the schools or
Yeah. So we're in preschools.
nothing done through the computers, though.
the hygienist takes x-rays and photos on site, which then we review on the computer to make a treatment plan
Oh, for the children
for the children.
in preschool, and then their parents bring them in.
If they need to be brought back into the clinic, then we help schedule those appointments, or if the children need a simple filling, the hygienist that is able to do it on site, then the hygienist does that at a subsequent visit. Or if the children have no problems, then we help them just keep them healthy in the community at the do their checkups regularly in the classroom.
So, Joanna, I had asked Corali and Diana what they would like to say to the viewing audience, what's important. And you were talking about going out into the schools. So that didn't relieve you from answering the question.
I would say oral health is very important. Like Diana said, don't wait until you're in pain.
And brushing 3 times a day
Yes.
can prevent some of that pain from even developing.
Yep. And floss like a boss.
What about water picks, if people have access to them?
If they can tolerate it, it's a great tool.
Tolerate.
Because the water from the water pick comes at a real high pressure.
But you can turn it, you can adjust it.
You can, yes. But even then, it's pretty high. And if they can tolerate, it's a great tool.
Okay.
Yeah, if
Now,
used correctly.
you are not exempt from talking about what you would like to share that's important.
I would say, don't be scared of the dentist. Don't be scared. And teeth are meant for a lifetime.
Not pulling teeth.
Not pulling
Not pulling teeth. We want to make sure we keep our teeth. Yeah.
Wisdom teeth as well? All teeth?
All teeth.
All teeth. Okay.
All teeth.
And plans for the future? Or do you have plans for the future?
Plans to grow the clinic
To
for
grow
now.
the clinic, to hire more staff,
And we can see more patients.
to see more patients,
And make a difference in our community.
to make a difference in the
See
community.
more smiles.
Yes.
Oh, that's right. Were you the one who said, yes, to see more smiles, more healthy smiles, with more
That's all
teeth
people
in
want,
the,
too.
with more teeth in the mouth. And what about talking about smiles? What about teeth whiteners? Are they recommended?
We don't offer that in our clinic, but it's a treatment that is available outside to patients.
Anything else you can think of in terms of sharing?
I'm not sure.
All quiet.
I know.
Anything you haven't said that you'd like to say?
I think we covered
Yeah,
a lot
covered
about
everything.
clinic
Yeah.
and,
Well, it's good to know you've covered everything because the time is up. And I'd like to thank the 4 of you for being here, sharing your experiences and your wisdom. And I'd like to thank our viewers for watching. Until next time.
Thank you.
Thank you.
Thank you.